Hello and welcome to the session. 6.1 3 International Healthcare Policy LO1. Understand healthcare policy formation in an international context. How do international healthcare policies shape global health outcomes? This video explores the intricacies of policy formation in an international context. Discover how global challenges and national priorities intersect in this complex process. International healthcare policy involves decisions and laws aimed at improving health globally. It is distinct from national policy due to shared global challenges. Such challenges include pandemics and health inequalities. Policy formation must balance global guidance with national needs. This complexity requires careful negotiation. Policy formation begins with identifying cross-border health issues. Examples include infectious diseases and non-communicable diseases. Data from organizations like WHO help define these issues. The scale and urgency are determined through research. This sets the groundwork for policy development. Key stakeholders like WHO and UN shape policy. They set health priorities and issue recommendations. Their guidance influences national strategies. However, they do not enforce policies. This highlights the importance of international cooperation. Political and economic factors greatly affect policy development. Wealthier countries often have more influence. Low-income countries may depend on international support. Cultural beliefs also shape policy acceptance. These dynamics complicate policy formation. Final policy formation involves negotiation and adaptation. Countries tailor global frameworks to fit local needs. This results in varied healthcare delivery. Even with the same guidance, implementation differs. Flexibility is crucial for effective policy application. The top-down model is led by organizations like WHO. They identify global health priorities and issue guidelines. This model ensures consistency and shared standards. However, national implementation varies. Compliance depends on individual governments. The partnership model involves cooperation between various entities. It is common in low-income countries. Shared expertise and funding are its strengths. However, it may lead to dependency on donors. Local needs might be overshadowed by donor priorities. This model relies on research and data. Best practices are identified through analysis. It improves policy effectiveness and accountability. However, countries with limited data may be disadvantaged. This can lead to underrepresentation in policy design. Policies are shaped by national security and economic interests. Rapid policy action is possible with this model. However, it may marginalize vulnerable populations. Economic interests can overshadow public health equity. Balancing these interests is a challenge. No single approach is sufficient alone. Combining global leadership and evidence-based research is key. Collaboration and political commitment enhance policy effectiveness. Balancing global standards with national autonomy is crucial. This ensures policies are relevant and aligned. Funding determines policy priorities and effectiveness. Financial constraints influence policy development. Budgetary decisions impact policy scope. Funding sources can lead to conflicts of interest. Aligning funding with health needs is essential. Governments must prioritize within fixed budgets. Long-term investments often lack funding. This skews policy towards short-term outcomes. Areas of greatest need may be overlooked. Funding availability impacts policy priorities. Well-funded systems can introduce comprehensive strategies. Limited funding leads to scaled-down policies. This creates inequalities in healthcare access. vulnerable populations are most affected. Equity in policy formation is crucial. Publicly funded systems rely on government budgets. Policies are vulnerable to political changes. Economic pressures shape policy objectives. Private funding can lead to market-driven policies. Conflicts of interest may arise. Adequate funding is crucial for policy success. Short-term funding limits long-term impact. Policy credibility is undermined without sustainability. Public trust in healthcare systems is affected. Long-term financial planning is essential. UK healthcare policy is centered on the NHS. It aims for universal access and equity. However, there is a gap between ambition and delivery. Underfunding relative to demand is a major issue. Political messaging sometimes outweighs realistic planning. Universal access is a key strength. Policies reduce financial barriers to care. Ethical foundations align with public health principles. However, theoretical access does not guarantee practical access. Implementation challenges remain. Chronic underfunding affects policy delivery. Workforce policies lack consistency. Staffing shortages impact care quality. Integration between health and social care is limited. Structural weaknesses hinder policy effectiveness. The UK excels in public health leadership. Vaccination programs are well coordinated. Emergency response planning is robust. However, preventative health policies need development. A short-term focus affects policy priorities. In conclusion, understanding healthcare policy formation in an international context is essential for recognizing how global, national, and local factors influence healthcare systems. Policy formation is shaped by political, economic, social, and cultural considerations, as well as international organizations and global health priorities. Understanding these influences enables policymakers and healthcare professionals to develop effective, equitable, and sustainable health policies. This knowledge supports informed decision-making and improved health outcomes across different international healthcare systems. Thank you for watching this video. If you have any questions, please feel free to contact us via email or WhatsApp at 07484361688.